I'm Dr. James Clough. We're going to be talking about Morton's neuroma and the implications a first ray has in treating this condition. First ray function is very critical to the treatment of a Morton's neuroma. When the big toe is locked and does not bend properly during normal gait, a common compensation for this will be to lateralize weight. This often involves moving around to the outside of the foot. When that happens, the fourth and fifth metatarsals become very hypermobile, and as a result of that, there's significant shearing force on the intermetatarsal nerve between the third and fourth toes. Once the mobility is restored to the big toe, and I do this by elevating the hallux slightly before loading, then I can restore mobility through that joint, and subsequently my trajectory of force will go right through the big toe, and they will minimize any compensatory motion on the lateral portion of the foot and subsequent shearing that's causing the injury to the third intermetatarsal space nerve. Addressing the first ray with Morton's neuroma will prove to be extremely helpful for you in your practice. In my practice, 90% of my patients have improved in conservative care when incorporating the Cluffy wedge into my treatment regimen.